Good afternoon. My name is François Marcotte. I'm an adult cardiologist working at Mayo Clinic in Arizona. I'm a senior associate medical consultant in cardiovascular disease, and I'm director of the adult congenital heart clinic here at Mayo Clinic in Arizona. I'm part of a large group of cardiologists here capable of taking care of cardiovascular disease, and my particular interest is adult congenital heart disease, as well as non-invasive cardiac imaging, which means taking pictures of the heart with ultrasound and MRI. I've been in cardiology for over 27 years, and I really enjoy it. It's brought me some great highs, a few disappointments, but mainly the feeling of having contributed to patients' health and well-being. And it's my pleasure to speak to you today.
Dr. Marcotte, thank you so much for joining us today. Let's get started. What is congenital anomaly?
A congenital anomaly is a structural defect that you're born with, meaning that there's something, a defect that occurs that is present at birth, and thus that you inherited before birth while being in your mother's womb. These defects are relatively rare. They occur in about 3 to 5% of all births. Interestingly, a lot of stillbirths or miscarriages are sometimes the result of severe anomalies that are not compatible with life.
Are congenital heart defects common?
Among the different congenital anomalies or defects that you can be born with, cardiac anomalies are actually the commonest. They're over a third of all defects. Sometimes they will occur in isolation, or sometimes be associated with defects of other systems. For example, neurological, the brain, musculoskeletal, the bones and muscles, and others. Congenital heart defects are thus present in about 1 to 2% of all births.
1 to 2% of all births, is that, in the scale of common to not common defects, how does this rank?
I guess it is rarer to have a congenital heart defect than, for example, to have high blood pressure, which affects 1 individual in 4. They are, however, quite varied, and they can be sometimes serious and even life-threatening. In fact, there are hundreds of possible diagnoses that may range in variety between valve defects or septal defects, sometimes also referred to as a hole in the heart, or a communication between 2 chambers of the heart that shouldn't be there. Sometimes there can be entire parts of the heart missing, also called atresia of a valve. So these are very technical terms, but that refer to a variety of diagnoses.
What is the cause of a congenital heart defect?
That's a great question, and we know so much and yet so little. We think that there's probably an interplay between genes or genetic factors, diseases that affect mothers, or environmental factors that affect mothers. For example, it's often said, very important not to consume alcohol while you're pregnant. Well, alcohol can sometimes, in a pregnant mother, cause birth defects, including heart defects. Exposure to drugs can also be associated. Drugs that are either prescription drugs or illicit drugs. So those should be avoided during pregnancy. So an interplay between genes, maternal factors, and environment. Mothers who are older at the time of conception also carry an increased risk of having birth defects. And so it's not an easy question to answer. From the genetic standpoint, about a third of defects are part of syndromes. Now, a syndrome is when you have a variety of different anomalies, often physical, so in the physical appearance of the face and ears and eyes, associated with anomalies of the heart or other systems. 2/3 are what we call non-syndromic, meaning that there's probably a genetic influence or genetic factor, but the heart appears to be the main or only organ affected. And those are less well understood. It's not a perfect transmission from mother or father to child. There can be sometimes generations skipped, and sometimes it's not even the same defect that a mother and child may have. So to answer your question in a convoluted way, we don't understand fully, but we have a good idea. It's probably those three things: genes, mother, and environment.
Thank you. We are taking Facebook Live questions at the end of this broadcast, so thank you if you've already asked a question, and if you have a question, please feel free to leave it in the comments section below, and we will get to as many questions as possible. My next question, Dr. Marcotte, how many types of congenital heart defects are there?
There are hundreds of possible diagnostic combinations and permutations. As I've indicated, you may have a valve problem, you may have a septal defect, which is an abnormal hole between two cavities of the heart. You can have a combination of these. Sometimes you can have entire parts of the heart missing. We also refer to that as atresia, for example, of a certain valve or of a cavity. This means that that cavity or that valve has not formed, thus placing greater strength on the remaining cardiac chambers of the heart and the circulation.
How are congenital heart defects treated?
Well, it depends on the severity of the defects. There are simple defects and there are very complex defects. The simple defects count for about 50%, fortunately, and the severity basically determines what needs to be done. Some of them pose grave problems at birth and thus have to be operated as babies or newborns. Others take a little longer to develop, and they need follow-up by a pediatric cardiologist, often with follow-up echoes or ultrasounds, and sometimes other tests to determine if an intervention is needed. An intervention can be through catheter-based methods, also called cardiac catheterizations, where, for example, a valve can be dilated by balloon angioplasty, or a defect, a hole in the heart can be closed with an external prosthesis or an occluding device. In the more severe defects, sometimes open heart surgery or cardiac surgery is required, and that takes the skill of a cardiovascular surgeon to be performed. Nowadays, these can be done with very, very low mortality, and thus children who used to die before 1 year of age or even 18 years of age now survive into adulthood. In fact, there are now more adults with congenital heart disease than there are children, even though the percentage of children affected is around 1% and that of adult is about 0.5. Well, you're only a child for the first 18 years of your life, depending on the state where you live, obviously, and then you're an adult for the remainder of our life. Now, you can argue that some adults take a little bit longer to become adults, but we'll convene that 18 years is when you become an adult.
That makes sense. Are congenital heart defects often discovered in adulthood?
Well, as I said earlier, there are now more adults with congenital heart disease than there are children. And in fact, there are probably over 1 million such individuals right now in the U.S. Now, as I said, for children, the same applies for adults. The more severe the defect, the earlier a discovery it is. And the presentation may vary between cyanosis, if you have blue lips or blue skin from your defect, to shortness of breath to others. So the more severe defects are discovered in childhood, and usually these individuals have been identified. But we do run into occasional defects that have been missed or simply not caught because they produce subtle signs like a very soft heart murmur, or simply that individual has not been in contact with doctors very much for various reasons. So it happens occasionally that we discover these at older age. And the circumstances can be quite interesting sometimes. You come in to the emergency room with a flu-like illness or some other symptoms, and then you get a chest x-ray, and then, whoa, your heart's enlarged on chest x-ray. Or you get an EKG for palpitations, and then someone discovers that you have an abnormal electrocardiogram or EKG. Or someone hears a heart murmur, and then you're scheduled for an echocardiogram, and we discover that, well, there's an abnormal valve, or there's a small hole within the heart. So the presentation can vary quite a bit, but usually, fortunately, our pediatric cardiology colleagues have identified these defects in, I would say, the majority of cases before 18 years of age nowadays.
And with that, considering that most people will probably be diagnosed with a congenital heart defect as a child, but it's a lifelong condition, and so they will need to continue to seek treatment. What does that transition look like from pediatric to adult care?
It's a great question. Transition means basically moving from the age of childhood to adulthood. And it's a complex process through which all individuals have to go through. When you don't have heart disease, it's hard enough going through adolescence and your rebellious phase or whatever phase you're in, this sort of tug-of-war you have with your parents of achieving independence. But when you have heart disease and you're trying to go through these normal years that young adults have to go through, it's sometimes a challenge. You're born with a heart defect, you were taken by mom or dad to the doctor, and you don't always felt part of the decisions. Basically, these were imposed on you, and it may trigger all kinds of psychological responses in individuals with congenital heart disease. The important thing, however, is that very few procedures done in pediatric age are completely curative. Some defects can be done with completely, but there's often a little left behind, a little leaking valve or narrowed valve, or hole in the heart, or perhaps some other problems, some arrhythmia, and those can sometimes be serious. So it's important, even though you don't want to do like mom and dad and be a good boy or a good girl and go to the doctor, it's important to realize that it's your life, and basically you have to take steps to ensure that you have a long life, because congenital heart disease can be a cause of a shortened life, and that's not a good thing.
And you touched on this, but can you talk a little bit more about the challenges of transition? So the challenges is first having ownership of your condition, understanding what you've got, basically, and understanding that what you've got is pretty rare, and that you need to have healthcare, or you need to have a healthcare provider that understands what you've got. Because these defects are rare, as we discussed earlier, not every center, not every adult physician knows how to deal with these. The best scenario is when your pediatric cardiologist or your pediatric healthcare takers refer you to a center that has these capabilities to perform adult medicine in an adult settings with all the different treatments that are available for cardiac and also for other conditions. Because having heart disease doesn't prevent you from getting health problems elsewhere, like being overweight, having high blood pressure, having diabetes, wanting to become pregnant. That's not a health disease, but sometimes it's the complications of a normal thing such as pregnancy that can lead to problems. So it's important to be able to trust the people who are going to take care of you. You should ask that their credentials to take care of individuals with congenital heart disease. And I think one of the best ways to transition also is to be informed. Now we're at the age of the internet and Google and all these search engines. There are now support groups for patients with congenital heart disease. I can think of the ACHA, the Adult Congenital Heart Association, which is a patient group that caters to people born with congenital heart disease, and can serve as a great resource if you're questioning, if you're not sure about your care or about what you should do to follow up with your condition. That's a good starting point. Thank you. Now we're opening up to Mayo Clinic Connect and Facebook Live questions. Our first question today comes from Patty. She said, hello, are high triglycerides a risk to heart, and could a high calcium level be the cause of high triglycerides?
This is a question that has more to do with general cardiology. High triglycerides are a fragment of a subfragment of the lipids, which are the fat within the body. There's cholesterol and there's triglycerides, and these are subportions of normal components of the blood system. You need triglycerides and you need cholesterol to fabricate membranes and stuff, but it's the excess of triglycerides and of cholesterol which can be noxious or dangerous for the well-being. Triglycerides by themselves are a modifiable risk factors. They're often related, when very high, to certain conditions like being overweight, having diabetes. The associated problem with high triglycerides can be what we call low HDL, which is a low subfraction of proteins that transport cholesterol that are actually good for the heart, which are often low in people with high triglycerides. So this is a general cardiology or coronary disease question. Calcium scoring is a more frequently used screening tool in cardiology, and it basically looks by CT scanning, which is a very powerful X-ray that's done across the chest to look for calcium deposits. And there can be calcium in the bones, and that's quite normal, but there can be sometimes calcium deposits in other parts of the body, and one of which can be the coronary arteries. And what that means is that there's probably what we call atherosclerosis, or fat buildup within the arteries of the heart. They may not be severe, but it just highlights a process that's ongoing that promotes coronary disease. And coronary disease, well, is something that can affect all Americans, even those with congenital heart disease. But it's a very different health issue.
Thank you. We have a question from a Mayo Clinic Connect member. Is exercise recommended for children and adults with a heart defect?
Great question. Yes, absolutely. Exercise is the approach to exercise in patients with congenital heart disease has evolved greatly throughout the years. We obviously would not recommend severe exertion in patients with very severe heart disease if they're unstable. But we find that exercise training, a low to moderate level exercise training regularly, can be quite good in all patients, pretty much all patients with heart disease, provided they are stable and cleared by their cardiologist. Exercise training can be done in heart failure patients, it can be done in congenital heart disease patients, and it's a good thing. It reduces, it may reduce cardiovascular risk, although we do not have perhaps scientific proof that heavy exertion prolongs life. We certainly would know that a low to moderate type of exertion will keep you in shape, keep your body well toned, and reduce risk factors like being overweight, having high blood pressure, having excess sugar or diabetes, and those can be good in the long run. People can sometimes exaggerate the other way, and if you look at the benefits of very heavy exertion, like ultramarathons or Ironman and those type of things, well, those are very demanding on the individuals and may not be appropriate for people with heart disease. In fact, a non-negligible number of people can sometimes have serious complications from such high intensity. So you always, when you exercise, you have to be sure that your primary care physician, and if you're a cardiac patient, your cardiologist agree with what you're doing. You've got to practice sports intelligently and be mindful of the risks that can be entailed.
Thank you. On that note, Alan from Facebook asked a similar question. Can walking be as good as any other exercise?
Walking is the best exercise. It's cheap, costs you nothing. You got to watch where you're going, obviously, but it doesn't cost much. It's fun. You practice it with people you like. You can keep a conversation, and it's quite aerobic. And it's actually an Olympic sport. Walking is actually an Olympic sport. So a brisk walking can be is probably the best type of exercise, a low risk of body injury compared to jogging or other contact sports. So I would definitely recommend walking as a very important part of any fitness program. It's good for all ages. So get out there and move.
Alan, I hope that's encouragement for you. We have a question from a Mayo Clinic Connect member regarding a 4-month-old with a 10 millimeter VSD, severe pneumonia, and heart failure admitted to the hospital for the past month. His pneumonia is out of control. I know you can't provide a diagnosis or a treatment plan, but any thoughts that you might want to recommend?
How old is the patient?
4 months old.
4 months old. So that's very young. Ventricular septal defect is probably one of the commonest congenital anomalies diagnosed in babies, in term babies. And it does place the heart at a certain amount of stress. There's a lot of blood flow that goes through the lungs. And sometimes the lungs will be hypervascular. They may be a little bit stiffer. And thus, it may be difficult for the baby to defend him or herself against infection. So it's often a presenting complaint that often, once resolved, may lead to the necessity to close such a defect. Pneumonias can happen in every child, but protracted infections in what we call shunt lesions, which are when you have a hole in the heart and some of the red blood goes into the lungs, may have this effect. And so that's why these babies have to be watched carefully. They should be assessed by a pediatric cardiologist, and a decision has to be made whether closure would be the best treatment for that. It's up to the doctor really to determine that. But it's a common association.
Thank you. We have another question from a Mayo Clinic Connect member. They wrote, I have a 40-year-old daughter born with AVSD, and she did great for 39 years after repair at 9 months old. Then at 39, she developed endocarditis and ended up with a mechanical valve after nearly dying. Now, fear and stress are very high. Any recommendations or thoughts?
Well, endocarditis is a serious complication, and AVSD is one of those defects that stick out in my mind as a not so benign defect. For people who've had repaired defects, if there are no residual problems, we now have guidelines that tell us when to employ what we call prophylaxis for dental work or for surgery in general. Prophylaxis means administering antibiotics at the time of a surgical procedure like dental work in selected patients with heart defects. Now, those who have artificial valves, those who've had endocarditis, those who have residual defects where previous repair was made, those who are blue still or who have really serious types of disease should have these types of antibiotics. One thing and that's for dental work, obviously. The guidelines have relaxed themselves a bit with gastrointestinal and gynecological procedures, because the bacteria there don't tend to be as heart-minded, or they don't have this attraction the way teeth bacteria have for the heart. But you've got to be vigilant. I really feel for this person because it's a common problem, and certainly my approach to AVSD patients with residual mitral regurgitation on a cleft mitral valve, which is possibly what this person had, is associated with the residual defect, and that's the kind of defect where we should provide antibiotic prophylaxis. Now, having said that, the thing we sometimes forget is that there are other ways bacteria can enter our bloodstream. So the teeth, the gastrointestinal tract, that's one, but there's also the skin. So it's very important to take good care of your skin. If you have, you should wear good shoes. Protect your feet against blisters and other. And if you have wounds, you need to attend to these. Wash them carefully. Use soap, and then to treat serious skin infections as well, because the skin bacteria can also sometimes infect the heart. So teeth and skin bacteria are the ones to be really careful about. But it's a really tough. Endocarditis is a really tough problem, and it's associated with a high risk of dying. So I can certainly understand why that patient had the scare of her life for her child.
Yes.
It's not easy.
Well, Dr. Marcotte, thank you so much for joining us today. This has been a really great conversation. For our viewers, this video will be available on the Mayo Clinic Facebook page in the left-hand column under the video section. It will be available at the conclusion of this live broadcast there. Any final words or thoughts for our viewers?
Well, I'll just wrap up by saying that congenital heart disease is fortunately a relatively rare health problem, but certainly a significant one that affects, for congenital heart defects, about 1 to 2% of all births, Congenital heart defects account for about a third of all inborn defects of the body, and can vary very much in its presentation. Most of these defects are discovered at birth or in childhood, thanks to the excellence of our pediatric cardiology colleagues and to the skill of our cardiovascular surgeons and interventionalists. These individuals now survive into adulthood. Transitioning from childhood to adulthood means taking ownership over your health, assuming healthy choices, healthy eating habits, not smoking, moderate alcohol consumption, no drugs, and basically if you have a congenital heart problem, seeking the best possible care that you can get through a certified physician from a reputable institution. Don't shortchange yourself. You should seek the best possible care for yourself and make sure that your doctor understands exactly what's going on with you, because these are rare defects, and it would be a shame to waste the efforts generated by our pediatric cardiology and cardiovascular surgery colleagues in adult life. Over 1 million of Americans are affected with congenital heart defects, so this isn't rare. You probably know someone who's had surgery as a youth or as an adult for a congenital heart problem, so it's not rare. So I wish you the best of luck. I thank you for your tuning in, and I hope you have a nice day. Thank you.